Barbara has 35 years of building a tremendous healthcare network and services.
I remember walking into the clinic. I walked up these very rickety stairs, opened a torn screen door, and went into the top floor of a church building.
I don't think she ever intended to build a big empire of clinics or anything like that. I think she was just out there to help people, and there was a need of the community to help people.
We had a part-time doctor and a part-time nurse practitioner, and in the evening, we had about 25 doctors from Camp Pendleton that rotated through, taking care of the patients.
I think that most people became aware of the clinic because of Barbara's presence.
She's the face of this community clinic for our community. So many people associate the clinic with her.
It was hard to not be drawn into her causes and her passion.
Over the years, it became quite obvious that we couldn't stay in that building. The need was so great for health care, affordable health care. There's so many people that were uninsured in our community.
It was exciting to hear her plans, always for expansion, always growing, always providing additional services.
It wasn't all about buildings and construction. It was about medical services and health promotion services and helping people lead healthy lifestyles. Today, there's over 530 staff members.
Many of them have been there as long, if not longer than me, because they have so much enjoyed working for an organization as well run as it is because of Barbara's leadership skills.
I am always amazed at her energy, her knowledge. She's just a remarkable woman.
She wanted to make sure everything we were doing linked back to the best care of the patient.
A little over 5 years ago, I was diagnosed with kidney cancer, and it was a huge surprise. I felt fine. Knowing what I went through and the anxiety and the fear that I had, when I was asked what kind of legacy I would like to leave for Vista Community Clinic, I thought of early detection and treatment for cancer.
I found a bump in my breast.
I experienced bleeding, and I made an appointment with the clinic.
It was Thanksgiving morning, 2011, and I get a phone call from my mom that my dad has turned bright yellow.
Vista Community Clinic fills such a unmet need.
It's a safety net for people who've lost their jobs, who don't have insurance, who have children that need insurance.
When they have the community clinic behind them, that's a team. And that team, with the patient in the center, is what makes it work.
Our crowning jewel right now is the Women's Center.
Women are able to come in and get a breast exam and a cervical exam. Colon cancer screening is also available.
We see people at Vista Community Clinic that have health problems and they ignore them for years because they can't afford to go to the doctor.
I told me how to go to the doctor. My mom panicked because my dad's a plumbing contractor. They don't have any insurance.
The company I was working for didn't provide any kind of insurance, and they kept us all part-time so they wouldn't have to provide it.
She saw that I was nervous and I was scared, and she knew of some fund that could help me pay for a biopsy.
People come into the clinic knowing that they're going to get taken care of with respect and be treated with dignity.
When I walk up to the front desk, and they see a lot of people, but they know my name.
We have such competent doctors and nurses and staff who are very caring.
They're willing to go the extra mile to find that hidden resource. They're willing to go the extra mile to teach that teaching point that will help the patients take better care of themselves.
I have never seen doctors more amazing than the ones at Vista Community Clinic. They served as his primary care physician through this whole ordeal.
They determined that it was bladder cancer.
They gave us our preliminary diagnosis of pancreatic cancer. And they pulled me off to the side and they told me that my dad had 90 days.
If we do develop cancers, let's find them early. Screening is the most economical way to deal with the problem.
A pap smear can be as little as $15, but cervical cancer and the treatment for cervical cancer and chemotherapy will run into the thousands and thousands of dollars.
We need to really reach out to families and make sure that we are educating them about the need to have early detection and prevention.
It's not uncommon at all for our patients to come in the late stages of illness. And unfortunately, when it's a patient with cancer, that can mean a death sentence.
Every day we have people that walk into the clinic can barely afford to pay the minimum fee in the clinic. And if I was one of those people, I might still be suffering with this problem, which would eventually have been terminal.
I believe the clinic saved my life because I would have gone on just ignoring the symptoms because I wouldn't have known where to go.
After several surgeries, my dad is still with us.
Vista Community Clinic has the tests and the procedures and the skill and the expertise at its fingertips for early detection for everyone that walks through the clinic. What the clinic doesn't have is the ability to pay for all of those services. When the physicians are doing an exam, they often have to make recommendations to the patients for tests that aren't covered. And many times, the patient can't afford it and they choose not to have those tests.
When we were sent to the first specialist, my mom started crying because she thought, we can't do it, we can't afford it.
I'm hopeful that this legacy, this detection fund, will provide the first step for those people that need care but can't afford to get it.
People with jobs, that's what my dad kept saying. I didn't know it was for people with jobs. I didn't know that people with jobs could come to the clinic and get help.
We have the system, we have the clinics, and we need to make sure we utilize them and support them.
I think that it's important for all of us to realize we are in the business of saving lives here.
We have to provide care across the board. It has to be all of us working together.
And with a fund like this, providing the screening services that are needed, then we could really put a huge dent in this whole cancer